Hello everyone, welcome to Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shanaz. Hope you all are doing great. Okay, in this short video, I'm going to talk about one very interesting topic for all the nurses, especially those working in the emergency department and those working in the obstetric and gynecology department. Okay, but before moving ahead, a small and gentle reminder to all my lovely viewers that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. And thank you so much to all my present subscribers for all your support, for all your likes, and for all your comments. Thank you so much. Okay, now coming to the topic of this video, it is the leading cause of pregnancy related deaths in first trimester. That is ectopic pregnancy. Okay, what is ectopic pregnancy now? Ectopic pregnancy, it is also known as extrauterine pregnancy. Okay, it is a life-threatening condition and also a medical emergency. Why is it so? We'll understand it as we move on. So, ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. Okay, in the other areas like maybe in the fallopian tube or in the cervix or in the abdomen or in the ovary. Okay, like instead of growing in the main cavity of the uterus, it grows outside the uterus. So that is called ectopic pregnancy, and in 90% of the cases it grows in the fallopian tube. Okay, fallopian tube is the most common site where ectopic pregnancy happens, and that is called tubal pregnancy. Okay, so as you can see there in the pic, okay, tubal pregnancy, ectopic pregnancy, fetus growing outside, the fertilized egg growing outside the uterus, outside the main cavity of the uterus in the fallopian tube. Okay, so this is ectopic pregnancy. Now let us understand what normally happens. Okay, see, these are the female reproductive organs, internal female reproductive organs. What all we have there? We have the uterus. Okay, and we have two fallopian tubes which are attached at the upper part of the uterus, and then two ovaries on either side. Okay, and then we have the cervix and the vagina. Okay, so what happens is normally the ovaries, their function is to produce ova, yes, eggs, and at the time of ovulation they release this ova which travels through the fallopian tube. Okay, it goes to the fallopian tube, and fallopian tube, it's a connection between the uterus and the ovary. Okay, so ova is transferred from ovary to the uterus from through fallopian tube. It's a pathway. Okay, that narrow tube that you can see over there, it's a pathway for the ova to travel, and the uterus, the main cavity where the fertilized egg implants and grows. Okay, so this is normally happens. Now fertilization normally occurs in the fallopian tube. Okay, the ova is released and the sperm, they travel through the vagina and the cervix, through the uterine cavity, and it goes into the fallopian tube where the fertilization occurs. Then after the fertilization is done, the fertilized egg, it travels through the pathway of this fallopian tube, and it gets implant itself in the main cavity of the uterus where it grows. Okay, where it grows, where it gets all the right amount of nutrition and the blood supply and all the support that it requires. Okay, so uterus is the main cavity or the natural place where the fertilized egg is supposed to implant itself. Okay, and it can expand. Okay, as it is blessed by the nature, it can expand as the baby grows. Okay, fallopian tube is not the right place where the fertilized egg or the embryo is supposed to grow there. Okay, it cannot expand like uterus, and therefore it can rupture, leading to complications and even death sometimes. Okay, so this is ectopic pregnancy. So what happens is the fertilized egg, it does not get it move towards the what we say uterus. Okay, instead it grows into the fallopian tube or in the other parts, as I said, maybe in the ovary or in the abdomen or in the cervix. Okay, apart from the uterus, and this is called ectopic pregnancy. Now coming to the causes of ectopic pregnancy. What causes ectopic pregnancy? In most cases, the conditions that slow down or block the movement of the fertilized egg down the fallopian tube. okay, leads to ectopic pregnancy. Means any condition which either slow down or block the movement of the fertilized egg through its pathway, that is fallopian tube, into the uterus, causes ectopic pregnancy. And that includes, like, if someone is having irregularly shaped fallopian tube, means they are born with an irregularly shaped fallopian tube. And the second cause can be if the fallopian tube have been damaged due to sexually transmitted infections. Okay, the sexually transmitted infection which cause damage to the fallopian tube, and so the ova is not able to transfer itself into the uterus. Okay, and scar tissue or additions or inflammations from the prior pelvic surgery. Okay, they have undergone some pelvic surgery before that, and there are some additions or scars. Okay, that also causes slowing down of the what we say, the fertilized egg. And other includes, like, those people who are at higher risk of getting ectopic pregnancy are like those with previous history of ectopic pregnancy. Means if someone is having a history of ectopic pregnancy before that, then they are at risk of developing ectopic pregnancy this time too. And those with a history of pelvic inflammatory diseases or sexually transmitted infection, or those because what happens is these pelvic inflammatory diseases and the sexually transmitted infection, they cause damage to the fallopian tube, uterus, ovaries and cervix, slowing down all this natural process. Okay, and those with history of surgery on their fallopian tubes, maybe tubal ligation or any other surgery, or those with history of infertility and they have undergone treatment for infertility with in vitro fertilization, that is IVF. Okay, and those with history of endometriosis, or those with a history of IUD in place, okay, intrauterine devices in place at the time of conception, and those with history of smoking, tobacco consumption. Okay, so all these people are at higher risk of developing ectopic pregnancy. And those with as the age increases, the risk of developing ectopic pregnancy also increases. So those women who are over the age of 35, they have a higher risk than those women who are under the age of 35. Okay, so in 50% of the cases who have ectopic pregnancy, we see these risk factors, and in 50% without any risk factors also, they can develop ectopic pregnancy. Okay, so this ectopic pregnancy, it can cause life threatening complications, especially when the tube breaks. Okay, so the normal signs and symptoms, yes, I'll tell you, but if the tube gets burst or breaks, then that can cause serious medical complications, and it is a medical emergency that need to be promptly attended. Now coming to the signs and symptoms of ectopic pregnancy. See, ectopic pregnancy occurs in about 2% of all the pregnancies, and symptoms of ectopic pregnancy, they develop fairly in the early pregnancy itself, between 4 to 12 weeks. Okay, so the early symptom of ectopic pregnancy can be very similar to your typical pregnancy. Okay, the person may have vaginal bleeding, okay, pain in the lower abdomen and pelvis and the lower backache, dizziness and weakness. And in case if the fallopian tube ruptures, okay, the pain and bleeding can be very severe. Okay, it can be very severe. Okay, and they may also have fainting, low blood pressure, hypertension, shoulder pain, okay, rectal pressure or bowel problems. Okay, that is in case when the tube gets ruptured. And if the tube burst, they may have a sudden sharp lower abdominal pain, and it's a medical emergency and they need to be treated promptly. So as you can see over here, the ectopic pregnancy symptoms: nausea and vomiting, tender breast, dizziness, severe vaginal bleeding. Okay, vaginal bleeding will be moderate initially, but if the tube bursts, it can become more severe. Okay, and severe pain too, and sudden cramps. Okay. The causes here are again discussed, that is pelvic inflammatory diseases, yes, and irregularly shaped fallopian tube or intrauterine devices in place at the time of conception, and with those with history of previous ectopic pregnancy, advanced maternal age, yes, and those with history of tobacco consumption. And this is a picture showing how normally the fertilization and implantation occurs. Yes, so the ova is released from the ovary. Yes, here it is. The ova is released from the ovary here, and then during the ovulation, the ova is released and it travels through the fallopian tube here. Okay, and the sperm travels from here, from the vagina through the cervix, through the uterine cavity, and then it reaches the fallopian tube where fertilization naturally occurs. And then the fertilized egg moves from the travels through this pathway of fallopian tube and then gets implanted into the main cavity of the uterus, okay, where it grows. Now, how this ectopic pregnancy is diagnosed? Ectopic pregnancy is diagnosed by urine test, blood test, and ultrasonography. Okay, ultrasonography is also done, and certain blood tests are done, urine test is done to confirm this ectopic pregnancy, and of course the signs and symptoms, history collection. So now coming to the management part, ectopic pregnancy, as I said, it's a medical emergency, especially if the tube ruptures. It can cause serious complications and even death. Okay, so to save the life, see, ectopic pregnancy always results in loss of pregnancy. The pregnancy cannot be continued. The fertilized egg need to be removed, okay, from there. It cannot, the pregnancy cannot be continued at all. It is always loss of pregnancy. And what they do is, for medical management, they use methotrexate. Okay, methotrexate, it is a chemotherapeutic agent and also an immunosuppressant. Okay, immunosuppressant, which can be given to medically manage the ectopic pregnancy. Okay, what it does is it kills the cells. It stops the growth of the cells. It kills the cells, thereby ending the pregnancy. Okay, and later on that can be removed. Okay, and the benefit of giving methotrexate injection is that, you know, the tubes are preserved. Yes, the fallopian tube is preserved. We don't cause any damage to the fallopian tube. Yes, and how many doses are required, one injection or second dose is needed or not, that is confirmed by checking with the HCG levels. Yes, usually HCG levels, that is human chorionic gonadotropin hormone, these hormone levels are increased during pregnancy. Yes, as the what we say, the fertilized egg gets implants into the main cavity of the uterus and start growing, the HCG levels automatically rises. But if it is not getting implanted into the main cavity of the uterus, or it is extrauterine pregnancy, then it is obviously low. Okay, so this indicates that low amount of HCG levels in the blood indicates it is an ectopic pregnancy. Okay, so what they do is they check with the HCG levels when they, after giving methotrexate injection, and when it is low, yes, that it is working. Okay, and the second dose is required or not, that is again decided by the gynecologist or the obstetrician. Okay, and the next option is the surgery for the ectopic pregnancy, that is laparoscopic surgery is done to remove that fertilized egg, or sometimes only the fertilized egg is removed, preserving the fallopian tube, and sometimes the fallopian tube is removed with the fertilized egg inside. Okay, so it depends again on the condition of the patient. Oh yes, this picture gives a very clear idea of, you know, where all the fertilized egg can grow. Yes, apart from the uterus. Yes, it can be in the ovary, that is ovarian ectopic pregnancy, or in the abdominal cavity, abdominal ectopic pregnancy, in the cervix, cervical ectopic pregnancy. Okay, different places where the fertilized egg can grow rather than the main uterine cavity where it is naturally supposed to. Okay, so this was in short about ectopic pregnancy. Ectopic pregnancy, unfortunately, it is fatal to the what we say, fatal to the fetus. Okay, a pregnancy cannot be continued. Okay, and it needs prompt treatment. Okay, it needs prompt treatment. The egg is not viable there. Yes, and the tube ruptures, then it can cause more complications and life threatening to the patient. Okay, so it requires prompt treatment. So this was in short about ectopic pregnancy. Hope the content was helpful to you. If you like it, please do share it with your friends, and I expect more and more love and subscribers. Yes, so at the end I would just like to say that don't let others negativity affect you. Be positive, be symbol of discipline, courage, honor, dignity, and what we say, a good personality. Okay, So, and always, as I say, please help others in whatever possible way you can. Okay, please do like, share, and subscribe. Thank you so much for watching.